up next, we are talking about social environment panel. We have Dr. O'Neil, we have Stacy Flanagan, who's the Director of Health and Human Services, and Paul Bellan, who is the Director of Injury Prevention.
So perfect. So Dr. O'Neil, I mean, you started to say this in the beginning, so if you could just briefly remind the folks that are watching this video, what is this correlation between public health and violence? You know, where's the crossover? Why is the health planning class at NJCU every year covering this topic? If you could just remind us and educate us, please.
Well, this has been, the statistics have been repeated a couple of times throughout the event, and I think that it's really important that we, come back to the statistics and the numbers, and that is that according to the Centers for Disease Control, the 3 leading causes of death in the United States are homicide, unintentional injury, and suicide, with violent deaths being more often than not, again, mostly associated with violence. So talk about these numbers, couple this with the fact that the United States had a homicide rate that's 7 times higher than any other high-income country, with those homicides committed by firearm being 25 times higher. So it is critical that we're looking at this from a public health perspective, and that's why I brought my students here every year for the last 5 years to say this is happening in our community, it's happening in our backyard, it's not acceptable. And as agent of change in this community, we can do something about it, and we're going to learn how to do about it, what to do about it today and in the future as future public health experts. So with violence as a public health issue, a couple more things that I do want to touch upon before handing it over to Stacy and Paul. Violence leads to injury and death. And this is exactly the cornerstone of how health is measured. So from this perspective, it's a no-brainer. It's a no-brainer that violence should be treated like a disease. So with using a public health approach, we can certainly advocate for physicians and other professionals such as teachers, social workers, mentors to step in and to provide that preventative care, or just to sound the alarm if they think something is off with any community member, especially youth. So, for example, trained professionals can be armed with tools. And one of these tools that I'd like to highlight is ACEs, which is called the Adverse Childhood Experiences Survey. This particular tool acts as an assessment of one's future health outcomes as it relates to childhood trauma. So, in essence, the more trauma that is experienced in childhood, the higher the ACEs score, and poor the health outcomes are, with mortality rate lower in younger in life. So people are dying younger because of this trauma. And it's not necessarily because they are getting killed with homicide or suicide all the time, though that is one of the trends. But it's much deeper than that. Dr. Vicente really went into that, in great detail. So with this being said, if we can use tools like ACEs, not only can we initiate early intervention, but we can use it epidemiologically to stay ahead of the curve and to be able to track trends before they even happen. That is such a powerful thing. But we need to arm our providers with these tools in order to get ahead of the curve. So in summary, all of us really do have a responsibility to respond on an interpersonal level and on an ecological level to cure violence. We know that supportive relationships help curtail violence. We know that education and on things like life skills and conflict resolution at an early age can disrupt the cycle of violence. We know that choosing language that's going to empower our youth, and that helps with curtailing violence. But it is imperative that we also provoke societal thought about the culture of violence and the intergenerational systems that have created this phenomenon. The ethical, legal, and policy dimensions of violence reduction and prevention efforts must not only take history into account, but also should look forward with an emphasis on how communities and providers can draw upon our collective social and cultural influences and experiences. If we use this social capital, we together really can create a sustainable, community-centered set of initiatives and legislation that really addresses the systemic causes of violence, as well as providing those therapeutic tools to help combat violence on the ground. So violence is a public health issue. I mean, I believe that really sums up why we do need to approach it from a medical model.
Thank you so much, Erin.
You're welcome.
Stacy and Paul, so everyone else had already, so Erin was on a segment before and she did an introduction. So I want to make sure that you have your introductions as well. So if Stacy and Paul can introduce themselves and then I can go into the questioning, I really would appreciate it. Unmute yourself, Stacy. I see your mouth moving, but I can't hear you.
I think that I was ever muted. I feel like I need to change my background screen to show you our violence prevention model. I don't know, Paul, if you have the Kresge cartoon that we created on your laptop, but if so, you might want to pull it up. But I use this backdrop because, like, while I'm the leader, my team is really the people in the community making this happen. And I think it aligned a little bit with, like, healthy heart means so many different things. As a director of the health department, 2 years ago, we said that, you know, if they're giving us an opportunity on the council to rethink some of the divisions, because we were moving immigrant affairs and veterans affairs out of the resident response center and into the health department to have a little bit more connectivity to targeted populations that need wraparound services because of similar things that we've been talking about, primarily some ACEs work, but traumatized individuals that kind of experience so many different traumas. One, veterans, like all the things that they go through, others, immigrants and the immigrant experience and what they go through, couples with, you know, something else that we thought was really important, which was some injury prevention. We toyed a little bit with the idea of, is this like a public safety slash like public health, or is this, you know, really about injury? So we settled with the words injury prevention as a division, and Paul will talk a lot deeper about the work that he's doing, but it came from a framework of violence as a health issue, and to really look at how we can provide those additional services that a department like health and human services, where in some cities it's just the health department and all your human services are either coupled directly with mental health. So like in New York City, it's the Department of Mental Hygiene. And in other places, it's just social services. So that hybrid of human services of like kind of addressing those different target populations and allowing us to provide more services was really kind of where we decided to get started. To deepen that, we thought it needed like a pretty broad approach. So I'll have Paul like kind of jump in and then introduce himself through that division.
Paul, whenever you're ready.
I don't know if he thinks
he's talking, but I don't hear him.
Yeah. Can't hear. So he's now, I think he's got it. Oh, you hear?
No, I was on the phone, so I switched to computer audio. This should work.
Okay.
You got it now?
Yeah,
you're on.
All right. So, well, it's good to be with you all today.
Yes, it is.
So just a brief word of background here in the health department. We have a whole lot of varied backgrounds, which is one of the great things about the field of public health. It's a discipline that involves people from a lot of different places. My own background is as a computer nerd on Wall Street, trained as a psychotherapist and chaplain, and worked as a social worker in homeless services, which is great preparation for being here. Through the mayor and director's vision, our goal really is to take a different kind of approach to our work, which is to try to think strategically about where the opportunities and partnerships are. We've heard all kinds of problems that we have in terms of connection. People doing one thing here, another thing there, and we have not managed to harness fully our collective power to really make a difference when it comes to violence. The traditional approach has been a law enforcement approach. I won't say much about the health-based approach because I think that many people here are already familiar with it. But we know that violence looks like a communicable disease. People catch violence by being exposed to it. Violence can be treated by doing the same things that people have been using to treat other disease outbreaks for more than a century, from cholera to AIDS to Ebola. So that's really the direction that we want to take, and I think among some of our core group, there's a real consensus that that's an approach which makes sense. What we're doing here, slightly delayed for a few months because of the recent viral outbreak, but we're looking down the road to start normal programming or a new normal of programming. So our funding efforts are still in place. One of the things that we find, that we already know, is that while money doesn't answer everything, it is really the important thing in this work, because we need money to fund people to do the work. And we know that there's certainly a different allocation of resources in the past, which can be rediverted to enable the kind of work which really reduces street violence through these public health approaches of focusing on, not targeting, but focusing on the people who are at greatest risk. And we don't really care so much if they're at great risk of being a perpetrator or a victim, because often they're the same people, and preventing the violent incident is great news for people on either side of that terrible transaction. Our charter with the Violence Prevention Task Force is really to look at all violence, and that includes domestic violence. I just want to mention that briefly because slightly on hold, but we should be starting up after we emerge again from our COVID cocoon, is a domestic violence offender treatment program. We know anecdotally that that is very important in our city, both in terms of the violent statistics overall, but also because of the way that it creates those adverse childhood experiences, which are so important to people's long-term health outcomes. And it sets a terrible example if people think that violence is a way to get through the world. We need to change the norm where people think that way. I want to go also a little bit into, Robin earlier talked about that old phrase of hurting people, hurt people, hurt people, hurt people. Mm-hmm. We'd like to sketch out the vision that healing people heal people. As we know from our own experience, people who have been through the system, people who have been exposed to violence but have found their own personal cure, are the ones who are really best positioned to do healing work, much the same way we know is true in addictions and other mental health work. So some of the things that we just have on the plate, which have been on pause because they require real in-person work, are things like starting body-based trauma recovery services. We had our first trauma-informed yoga classes scheduled for violence prevention survivors, for violence survivors. That is one of the first things we will pick up because it is automatically a small group setting and can be done safely with social distance, as well as going further down the road into designing the programs and securing the funding for the kind of real direct intervention that we all know is at the heart of what we do. The two things I want to mention quickly while we're here, additionally, I am proud to say that our division, I believe, is going to be the first trauma-informed organization within the city of Jersey City. All of our staff are in the process of certification from the State University of New York. Not that that in and of itself means anything, except that we have a commitment to trauma recovery at the heart of our work. That includes not just for the people we encounter in the streets, but as we know from agencies that work with trauma, that means ourselves. Trauma is also contagious, and it's really important to do our own work to be healthy and sane and grounded and whole, because that helps us do what we need to. And it also sets a great example for others to say, I want some of that rather than I want some of that other stuff. I think that is just about it, other than we're really excited about one thing which we know is coming very soon. We have been trying to do mental health first aid, so broad-based resilience support for mental health, but we've been trying to do it with youth and have just been stuck with the school system because of a variety of reasons, including the length of the class. We are about to get a shortened version, which is mostly or totally online. And as soon as that happens, I don't know if Principal Gadsden is here, but I have been reaching out for some time. The district and we would both like to make Lincoln High School the pilot for that, both because of its size and location. And if that works, we're then able to bring in a peer-based program in the school curriculum so that youth can be advocates for one another. Because who better spots the problem than the youth? I see Coach C out there. Steve, Pam, I know that you know that the youth know about things before we know about things. And
Absolutely.
if they're equipped, they're going to be able to take the first step to help somebody get the help that they need, which doesn't have to be psychiatric treatment, certainly doesn't have to be law enforcement, but it has to be help that is actual help. And that's why we are engaged in the work of health and building a healthier city. I've talked a lot, so let's go.
Like
yeah,
go.
so I had a question.
We love you.
No, I had a question, right, for Stacy, but I think Paul answered it. I'm sorry. So the question was, what do you see happening, or what would you like to see in the city as far as prevention efforts? But I think Paul, unless you have anything else to add, he kind of just laid it all down of what's going to happen, what was happening pre-COVID, what will happen, as far as virtual, while we're in, the pandemic, and then what will happen post-COVID. So if you want to add something, Stacy?
No, all I'm going to say is I think we're still figuring out what's going to happen during this environment. I think what Paul's saying is look, we're looking at every which way to get people back outside or figure out how we can really make a difference neighborhood by neighborhood, because this is also very stressful and traumatizing. And so we're seeing that with our veterans that are experiencing post-traumatic stress, or with our seniors, we do calls every day. And by the way, thank goodness for Angela, because Angela Cares has been so significantly out in the community, where we're literally answering calls. I mean, Paul and I are still at the office, but we're probably working 18 hours and trying to get some sleep, because so many people have such great need that they've never felt before.
Right.
We're still designing new programming. So, one thing I can't talk about yet, but what I've talked to Angela about, just better ways to do delivery system and get people that are overexposed to this virus in the house, so we can get some things out the door, which is why we often say to people sort of reach out to us, when you need something, let us know, because we also know all of you, and we know 800 other partners that are doing little things. So just so you're all aware, when the EDC starts to give out their money. So I am certain many people have read about it, but where the health department doesn't have any new money, the Division of Community Development does have new money from the CARE Act, and will be looking at COVID-related intervention and then post-COVID recovery efforts that involve all of your agencies, and hoping to figure out like how your agencies can access those dollars. That's one through the city, because that's going to be kind of like the CSBG COVID and other. And then there's going to be like other money that's doesn't have any ties to it, right? You know that a lot of the government funds are very specific in the way they want to see money spent. The EDC can be a lot more innovative. And so I am one of the people that is going to be reviewing all of the grant proposals. Of course, after I already said, like, I have this big idea, and they're like, give the money to everyone else. And I was like, that's fine. So now there's more money for all of you to really be innovative and like take a look at, I think there's going to be four categories. A large piece of what there's interest in is like food security. So like the direct work that, you know, Pamela, We Are the Village is doing, or Angela Cares is specifically doing with a specific population, you know, daily. There's going to be specific money for healthcare workers or first responders of that kind, whether it be, you know, people cleaning the hospital beds or grocery store, you know, cash rep, you know, clerks, to specifically have a fund for Jersey City residents that need immediate support. In addition to that, there's going to be other like youth organizations. So, you know, Coach C or Educational Gilmore or CNA, like from that perspective, right, really like developing proposals, because we already have a proposal like in front of us from our after school meals, you know, the Lily Pearl Foundation and Leonardo Webster. He's like, look, we can expand after school meals, because currently we're not doing after school work, but we just got approval from the state to do grab and go dinners and snacks from the after school program if you're doing virtual work, and we can get your kids that extra food in addition to that pandemic SNAP, right? So while those aren't things that we're like directly doing, we're like assisting the county who doesn't have the capacity, and the Jersey City Board of Ed to bridge that gap with all of the research that we're doing around sort of people that are still in need. So there's going to be a lot more to come over the next few weeks based on like whatever funding stream is going to be available. But I think already there's like $3 or $4 million in the Economic Development Corporation. And, you know, they've asked me to review proposals when they come in. I was just like I need more work, but I actually know what you're all doing versus some other people that are, you know, in the community, but not focused on your work. And so we know mental health and trauma related work is going to be really significant right now. I mean, I get emails every morning. I mean, on Friday night, you know, somebody's emailing the mayor saying like he ran out of oxygen and his like medical supply store was closed and his Medicare provider was closed, and like, how do we get this guy oxygen to make sure he makes it through the weekend? And, you know, we figured it out. It wasn't really easy, but, you know, we had a team of people. We got him to cans of oxygen to get through the weekend. But he had already like experienced his mother passing from COVID, and now he's got COVID, and he's, you know, got other immune issues. And, you know, we're really aware of that. We're also looking at like transportation issues, right? This is traumatizing. People don't want to be on the path. People don't want to be on the subways. People don't want to be on the city buses, and really scared of the light rail. And now we've finally got the light rail back to the hub this weekend, and it's probably going to be empty. And figuring out how to like expand the work that VIA is doing, and how do we support that through economic development to like allow people to be one person in a car, but be provided, you know, that kind of service like a shared ride, because those are things that are going to be significant. So there's a lot of like little things. So if you have any more ideas, we'll just put that on the pile of, you know, what other things that we can add to that and really think of. And I do have a team of students at the new school, that's my proud alum of Milano, that are organizational change and organizational change management students that are looking at some of these programs we're putting together and helping us with like the logistics around some of them so that we can be better prepared if there's an uptick again in September. Because, you know, we're budgeted right now to get this done right now, but no one's talking about 6 months from now.
Right. And I just want to, I truly want to thank Health and Human Services, Angela Cares, and any other organization that we reached out to, or somebody who we reached out to who reached out to you to get food to seniors and people in the housing authority. I sent Stacy a list of 20 plus homes who did not have food, and she made sure that she arranged that whole thing with Meals on Wheels and with Angela Cares to make sure if a senior was in the house, they got food. If there was a child or a baby in the house who needed milk, you know, they got the milk that they needed. So I really want to thank you guys for, I personally know that happened.
Yeah.
Right. So I thank you for that.
And there's more of that to come. So tomorrow, the Community Food Bank is going to drop 10 pallets at the annex of emergency food boxes. These emergency food boxes each have 40 meals in them. Tomorrow's list of partners are Action 21, Church World Services, Welcome Home, Women Rising, and then some COVID positive patients that have reached out to the mayor seeking help. So we're expecting, I think there's 28 per box, and we're getting like 280 boxes of 40 meals a piece. And we're partnering, this is our pilot. If this works, we're gonna do a separate project with the housing authority. So every group you gave us will get revisited with like one of these food boxes, Pam.
Okay.
The housing authority has expanded that. So now we have about 1,500 people throughout all the housing authorities, and we're going to help them manage some food drops between Table to Table and the Community Food Bank. The Community Food Bank shelf stable, these boxes of 40 meals, and then the other Table to Table is like the same like produce. And so we've been coming up with new policies around like food distribution and large scale to make that happen in an efficient way. So Logisticare, thanks to, you know, people like Angela and Nick Chivolotti, our state assembly people, reached out to me and said they want to pilot this in Jersey City. They want to see if it works. If it works here, it'll expand throughout the county. So tomorrow we have a list of drivers coming. They have a list of families that we've asked them to deliver to. We'll get all these pallets dropped, and the drivers will come, and we will put this stuff in their car, and they're just going to go out to all these organizations. This logistical transportation service is a state contract for Medicaid transportation for individuals on Medicaid to get to medical appointments. So they are not working right now. And so we obviously want people to have jobs. So if a driver doesn't have driving work to do, they're not getting paid. So we're helping them help keep people employed and do it in a really specific way to move that forward. So there's, you know, and we're going to tweak it the next week or two. And then hopefully we'll do that until June 30th. And then we'll come up with like all of the people that we interact with. We're going to make sure that like if they're not on SNAP, or if they don't have P-SNAP, if they have kids that are school age, they will get extra money for each day of school food onto their SNAP, so that they don't have to keep going, you know, back and forth to get this.
Right.
And so to really, and then that also like engages the economy, and it makes people spend more money in the economy. So figuring out how to do that in a better way.
Well, thank you guys so much. Truly appreciate you. Always happy to work with you, as we always do, and proud to be Healthier JC partners.
Yes. We're excited.
Yes, yes. I'll echo that. I mean, this event tonight turned into like a whole town hall forum where we had to regroup in the times that, you know, there's so much going on. So the information shared, the people that came on screen, everyone that came up, it was really needed. And I think a lot of folks, you know, we couldn't get through tonight without talking about COVID and the trauma related to that. So so we really covered a lot of ground. I was on the side commenting with Pam and Frank. I think this is our longest event yet, right? So I think we've been I mean, tonight was broken up into a couple of segments. We had some technical issues in the middle that we had to restart, but on total, you know, we've been on the line for about 4 hours, me, Pam, and Frank, like talking to people, jumping in and out. So it was a truly needed marathon conversations, and we're not over yet. We're not over yet.